Arthroscopy is a diagnostic and surgical procedure performed to eliminate joint problems. It is commonly used to treat injuries and conditions affecting the bones, muscles, ligaments, tendons, and cartilage, especially in the shoulder joint. When performing shoulder arthroscopy, a surgeon uses a small instrument called an arthroscope. This pencil-sized tool uses a camera and light system to obtain images of the damaged area. Images are shown on a large monitor where your surgeon can have a better view of the surgical site. Shoulder anatomy. The shoulder joint consists of the head of the humerus, upper arm bone, that fits into the scapula's shoulder blade socket. This ball socket joint is covered with cartilage to prevent the damage from friction when these bones move. Bones are also connected with flexible tissues called ligaments, which increases the stability and strength of the joint. Tendons are made of fibrous tissue, attaching the muscles to bones, adding mobility and extra strength to the joint. Various injuries and conditions of bones and supporting tissues can lead to shoulder joint inflammation, pain, and disrupted mobility. Shoulder arthroscopy indications. When initial treatment such as therapy and medication doesn't provide effective results, shoulder arthroscopy is the next step in the recovery process. The most common indications include damaged ligaments or cartilage, rotator cuff tear, bony projections or bone spurs, stiff or frozen shoulder, collarbone arthritis, shoulder impingement. It can occur when the arm is lifted and the scapula presses the underlying soft tissues. Shoulder instability. It could happen when the head of the humerus slips out of the scapula socket. This can be a result of joint overuse or an underlying injury. Biceps rupture refers to tears in tendons connecting the biceps to the skeletal system. What does shoulder arthroscopy look like? Shoulder arthroscopy is performed by a surgeon. Based on the nature and scope of your injury or condition, it can be executed in a side-lying or semi-seated position. This also determines whether regional or general anesthesia or a combination of both is needed. To get a better view of the damaged area, surgeons inject a sterile fluid into the shoulder to expand it. After that, a surgeon cuts a small hole in your shoulder and inserts the arthroscope. Once they get a good view of the problematic area, surgeons make separate cuts used for surgical instruments. This way, they have better access and a clear picture of your shoulder joint. Once the procedure is over, all instruments are removed and stitches are placed under the skin to close the incisions. Recovery after procedure. Wounds usually take a few days to heal after the procedure. There is no need for suture removal as we use a skin glue over the under-the-skin sutures. The affected arm could be placed in a sling for some time to allow your shoulder to heal. Pain medications could also be prescribed if necessary. The whole recovery duration depends on the type of problem the shoulder arthroscopy aimed to remove. Physical therapy is an essential part of the recovery once the wounds are healed. Its goal is to increase the shoulder's strength and mobility after the procedure. Pros of shoulder arthroscopy. Shoulder arthroscopy brings certain advantages over traditional open surgery. Smaller incisions translate to fewer complications, reduced pain, improved recovery, and a shorter hospital stay. Potential downsides. No surgical procedure occurs without risk. Shoulder arthroscopy could lead to certain complications, such as damage to the nearby blood vessels and nerves, bleeding, infection, or delayed wound healing. In some instances, short-term shoulder stiffness may occur. The essential part is to focus on recovery and commit to physical therapy to allow proper healing and minimize the chances of complications. The bottom line. Shoulder arthroscopy is a diagnostic and surgical method used to aid shoulder joints, ligaments, tendons, bones, and muscles by repairing any damages. It is minimally invasive and takes many years of training to do properly. Your surgeon will show you photos from your own shoulder and explain the details of your surgery in the post-operative visit.